I'm JJ and this is my son JR. Thank you for visiting the Team JR website. As many of you may know, JR was diagnosed with Angelman syndrome in March of 2007. JR has what's called the... Wow, he's pretty excited about that. He has what's called the UBE3A genetic mutation. What we're trying to do is we're trying to help the Angelman Syndrome Foundation with their Walk-A-Thon, which is on May 17th. Be held in 19 cities. We'll be participating in Chicago, and funding will go towards education and research for Angelman syndrome. But what we also want to do is we also want to put a face behind Angelman syndrome. We want to give you a kind of a behind I'm a little distracted, behind the scene look at everyday life with an individual with Angelman syndrome. So we're hopeful that physicians and families will be able to recognize this syndrome a little bit easier in early diagnosis. So obviously sit back, relax, enjoy the show. We'll see you in a few.
There are 4 characteristics consistent with all Angelman syndrome individuals. The first is developmental delays. To help JR overcome, we have him involved in activities such as aquatherapy. As well, he gets PT, OT, and speech at a local school and a local hospital. We also have JR involved in hippotherapy, which is horse therapy. At home, we do a variety of activities. This is a sensory table in which JR is working on developing his pincher grasp. Speech impairment is another characteristic of Angelman syndrome. Although JR is nonverbal, he's found a number of other nonverbal ways to communicate. As you can see, he points and grunts to get his way. All done.
That's a light. Yes. Doggy, good boy.
And fish are 4 of the 20 signs that JR knows. We also use storyboards as a way to repetitively explain a process to JR, such as dressing themselves. We just started working with an electronic tool called GoTalk.
Okay, look. No, press the button. I want cookies. No,
This electronic tool allows JR to communicate with anyone at the touch of a button. Balance and movement disorders are another characteristic of Angelman syndrome. JR does a lot of crawling, but he does a lot of walking, and recently was able to transition away from his braces and his walker. He still needs some help, but he's doing great. The 4th characteristic is behavioral uniqueness. These individuals are extremely happy. The syndrome used to be called the happy puppy. JR needs no help in being happy. Seizures are very common in individuals with Angelman syndrome. Approximately 85% have it. Fortunately, JR doesn't have known seizures at this time. Feeding and eating difficulties have also been an issue for JR. As you can see, he's eating with his mother in a specialized chair. JR also has a G-tube, and when he doesn't or is not able to eat, his diet with a G-tube. He tries hard. He's come a long ways. Here's JR with his backpack, and inside is his feeding tube that's connected into his stomach. Here's our little angel asleep. Sleep disturbance is an issue with Angelman syndrome individuals. JR takes 2 medications to get him asleep and keep him asleep. Without medication, he would sleep 3 to 4 hours per day, and naps are very rare. A few of the things that JR likes to do is swing in his swing outside, as well as visiting the neighbors and playing with friends and playing with their dog. As you can see, that behavioral uniqueness is a wonderful quality to have.
I was not lying about the excessive happiness. Thanks again for viewing our video. Again, if there's somebody who you think could benefit from seeing this video, whether it's a physician, whether it's a healthcare provider, please pass it on. Our goal is, again, to educate people about what Angelman syndrome is all about so that we can get earlier diagnoses. For our family personally, it took over 2 years to find a diagnosis for JR, and unfortunately, without proper diagnosis, you can't get the resources. Holy smokes! Okay, we gotta end this quick. We can't get the proper resources we need for JR, and you know what? Without the proper resources, it's just extremely difficult. So we're hoping that these individuals can have a better quality of life. So one parting thought before my son ruins the camera JR does have Angelman syndrome, but Angelman syndrome certainly doesn't define who JR is. So take care. Thanks again. We'll talk to you soon.